Well, there are so many factors that go into choosing a dentist, and that experience, quality, and care are certainly at the top of the list. There's also the X factor, how you feel when you walk into the office. Are you comfortable with the staff? For lifetime dental health, all of these things are important, and they want to build relationships with their patients. Here to share more, Dr. Richard Berry and Dr. Beth Love. Welcome to both of you. It's nice to have you here.
Nice to
Glad to be here.
And I just want to mention that this is the start of a weekly segment with you two. You'll be joining me every week on Daytime to talk about dental issues. Good advice, I'm sure, for our viewers as we go forward. But tell me a little bit about your practice. Let's start at the beginning. Dr. Berry? Well,
we've both been in the business for over 30 years, so we have lots of experience, and we're here to help any patients from age 3 to 103.
Well, that was one of my questions, Beth, is are you pediatric? Do you combine? Are you for everyone?
We're for everyone. Yes, we see children as young as even 1 year old. As soon as the teeth start erupting into the mouth, that's when we like to start seeing them. And
really? At that young age?
Yes, absolutely, because that's when their problems can start, and so we want to be there so that the problems can be taken care of.
And is it also a good idea to get them in young to get used to going to the dentist?
Absolutely. Yes, we bring them in, we let them get used to the office, we give them rides, we show them our little mirrors and all our little instruments and our glasses, and then they get to choose a prize so that they experience is a good experience, and then they walk away with, I want to go back there.
And that's what you want. Sure. Dr. Berry, I know probably through the years you have seen your share of folks who have anxiety when it comes to the dentist. How do you, in your practice, make sure these folks feel comfortable?
Well, first of all, when patients come in, we try to figure out what brought them in, what their problem is, what their concerns are, and we try to develop a tailor-made treatment plan for them. If they have fear for the dentist, we have ways to use conscious sedation to allow them to glide through their appointments.
And that's just probably one thing. You mentioned getting to know the patient. Why is that important?
Well, people come in for many different reasons. We don't want to assume why they came in. They have all unique problems, and we come up with unique solutions for them.
What type of dentistry do you practice, Dr. Love? I mean, is it everything from cleaning, and do you do any type of braces? What's your, how wide a range?
It's a very wide range. Both Dr. Berry and I are very committed to continually doing education courses so that we're on the cutting edge of everything that's out there so our patients can have. 6-month smile is of a form of adult short-term orthodontics, which a lot of our adult patients are loving because it gives them the straight teeth that they had when they were a teenager, and then they
shifted a little bit.
Yeah. And then we do everything else too. We're learning to do implants right now. We feel that's a very important thing for our population as our baby boomers are aging. We don't want dentures. We don't want partials. We want teeth that feel like teeth and are solid in our mouths, so that's very important. Everything else, though, from cleanings, restorative, of extractions. Dr.
So really,
Berry,
you're a one-stop shop for everything.
We are, and our patients really appreciate that they don't have to go out and meet a new staff and just do that whole experience over again.
Your office is on Bethel Road, Dr. Berry, and
yes, it is.
It's beautiful.
Thank you, thank you.
I think that in itself would make people feel good about coming to the dentist.
We try to make them feel comfortable there and feel like they're at home.
You've been in the business such a long time. How has the dental industry changed for you and for your patients?
Oh, there's constant techniques changing. We have to go to school all the time to keep up with it all, and we are on the cutting edge, and we have the latest technologies, and we have a very modern facility, and we have just about everything that's new in dentistry.
When you talk about people coming for that first time, do you usually have a consult with them and then they come back in for an appointment? Is it done on the same day, Dr. Berry?
Well, what we do is when they come in, it's all about them. We want to get to know them. We want them to get to know us, meet our staff, take a tour. And basically we listen. We listen to what brought them in, and we then develop, we do a thorough exam and determine what their problems are and from what they said, and come up with a solution for their unique problem.
Well, we've had your information on the screen so that if folks want to reach out to you, Dr. Love, Dr. Berry, they can do so. And knowing that they can be as old as 1 or they can be as old as 81.
Absolutely.
We want to see them.
Absolutely.
It's a pleasure to meet both of you, and we will see you next week.
All right, thank you.
It's been fun.
Pleasure.
Thank you.
Thank you.
Appreciate it.